Hi, this is Erica, and I am giving you my presentation for the patient's perspective. Okay, as an introduction, I just wanted to talk about the cultural focus of this project. I chose the Filipino culture as the focus. For those of you who don't know, the Philippines is a small Asian country off of the east coast of China. It's made of approximately 3 to 5,000 small islands. In terms of values, the people who are from this country have very strong family values, from immediate to extended family. All family members are very important to one another, and they're very close, despite having an extended family. From cousins, uncles, nieces, nephews, aunts, uncles, they're all very close to one another. Okay, for the patient story that I chose, I'm going to go ahead and read this. I got this from an article that I found from Oncology Nurse Forum, and it's about the experiences of Filipino Americans and pain, cancer pain specifically. So here it talks about, it's told from the perspective of the sister, so I'll just read it to you. My brother, when he was really in pain, and I told my dad, go and ask the nurse to bring something, my dad said, no, it's embarrassing to ask. I said, Dad, he's in pain. He needs the pain reliever right now because he was supposed to get the medication every 3 hours. It's already 5 hours. They haven't injected the pain reliever yet. I said, Dad, it's really past time and he has to get it. So I went out and asked the nurse. Okay, so when we're talking about the Filipino culture, we're actually talking about shared perspectives, okay? When I read that story, you're probably wondering, so who is this perspective from? Is this the patient or the sister? Because it sounds like the sister to me. But in reality, you have to think about the Filipino culture. Um, Whenever someone is ill, they traditionally adopt the sick role, and they're supposed to be stoic about their illness. They're not supposed to show any weakness. As a result of that, the family members become the representatives and advocate. Most especially the female members of the family, they will be the ones to speak up for their family members because the person who is sick, they're in that role. They're not supposed to really be the ones advocating for themselves. Someone else does that for them. So it's very fitting that the sister is speaking up for the brother because that really is the brother's perspective. It's shared between him and his sister. Okay, in terms of relevant domain, with regard to the No Metzger article that discusses aspects of culturally competent care from the patient's perspective, obviously I think the most important one that has to do with this article is the patient-provider communication. Now, the really important parts to think about in terms of patient-provider communication is that um, the healthcare provider needs to examine the patient population through qualitative and quantitative data. It's important for healthcare providers to know their patients and know what cultures they come from. For example, a great example actually of qualitative data would be the article that I got this story from. It talks about the perspectives of Filipino cancer patients' pain. And quantitative data, it would be good for a researcher or for a healthcare provider to go out and look for something that has quantitative data as well. Like, for example, some sort of study that shows the frequency percentages of Filipino patients who reported um, a decrease in pain from certain types of communication or pain management methods or pain assessment methods. Um, Data collection. It's important for the healthcare provider to know the race and ethnicity of their patients, socioeconomic status, English language skills, health literacy, and spoken language. Now, when a patient, especially Filipino, comes from a lower socioeconomic status and has a lower education or health literacy, it's going to be more intimidating for them. It's going to be harder for them to express their feelings and their emotions and their needs and wants. Usually, in terms of English language and spoken language skills for Filipinos, it's not really an issue, In the Philippines, English is already taught. So like a majority of Filipinos already know English, they know how to speak it, they understand it. Their comprehension and their speaking skills might not be very good, but they understand and can speak English fluently when prompted. So that's usually not an issue. Um, complementary alternative therapies. Filipinos really don't use these very often. They're very trustful of Western medicine, so that wouldn't be really an issue either. But the important part also is the need for further research that is emphasized very much so in the No Metzger article and also the Filipino cancer patient article that I had found. So there's definitely a huge need for further research into uh, not only just Filipino cultures, pain perspectives, but all different types of cultures as well. All right. Okay, in terms of discussion, who contributed to this situation? This is a really short, simple story, but it's got many layers and it's kind of complex. There's actually two main entities that contributed to the situation. There's the patient slash family, and also the RN slash healthcare provider. The RN actually is represents the healthcare system in general. Okay, so for the patient and family member, as I stated earlier, the brother, there's a Filipino brother and sister and a dad in the story. Now, clearly the brother is the one who has cancer, so he's the one who's in pain. He's the one in the sick role. The person who is in the sick role is not really supposed to be fighting for themselves and asking for all kinds of things. Their role is to actually just relax and rest and, just maintain a quiet dignity while they fight the illness. They're usually very stoic. They tend not to express pain or verbalize pain or their needs or their wants very well. And that is because in the Filipino culture, it is generally understood that there will be an advocate for this person. The advocate will be another family member. Usually it's a female. It's usually a mother or a sister or a wife. And this advocate will understand the patient and be able to speak up for him. They recognize their needs and their wants and can tell the nurse or tell the doctor or anybody else who's involved exactly what the patient needs and what they want. In this case, the sister is very close to her brother. In Filipino culture in general, brothers and sisters are relatively close. They're fairly close to one another. So the sister knows exactly what her brother needs, can interpret it for him, and tell the nurse. It's not the brother's responsibility to verbalize it. It's the sister who is taking his perspective and his suffering and conveying that to the nurse. The father here, you might be wondering, why isn't the father being an advocate as well? It's because it's the male role. In a Filipino culture, the males are supposed to be stoic and they're not supposed to really ask for anything. So the dad is, especially he's more probably first generation, he's not going to really ask for anything either. It's up to the female to verbalize all those things. Okay, the second part of this is the RN healthcare provider. We have to think about whether or not the nurse was providing good care for this patient. In the story, if you recall, the sister was saying that it had been 5 hours that the patient was able to get the pain medicine every 3 hours, but it had been 2 hours past that point. Was the nurse doing proper pain assessment? Was the nurse doing her rounding properly? It doesn't seem like she really was because the patient was in a lot of pain and too much time had already gone by. Okay. Okay, in terms of solutions, there's a few things that I was able to figure out here. Um, First of all of the responsibility for making sure that pain is handled properly goes to the RN. Obviously, we are all RNs. Being a nurse, a registered nurse, is a privilege and it's a professional role. It's something that we go to school for and we train for a long time. So it's up to us to have very good communication skills to convey to the patient, this is the pain regimen. You are allowed to have pain medicine that every so often. This is a PRN pain medicine. You must ask for the pain medicine in order for me to give it to you. versus scheduled. This pain medicine is scheduled. You don't have to ask for it. Maybe the nurse didn't properly convey to the patient that this was a PRN pain medication, but in any case, she should have properly conveyed that to the patient so that they knew that they had to ask for it every 3 hours or so. Proper use of evidence-based pain assessment and hourly rounding. There's been studies about using the 0 to 10 or the FACES type of the Wong-Baker FACES type of pain management scale. Any of those is evidence-based and does really well. Hourly rounding too. There's been evidence that going in every single hour to round on the patient will decrease the amount of call lights, will increase patient satisfaction. So maybe the nurse should have implemented some of those too. Collaboration on pain management, telling the patient that, hey, you are also a partner in this. Even though I'm the care provider, you need to tell me, and we need to agree on some sort of good pain management program for you. And research also, it's important, like I said earlier, for the healthcare providers to be aware of how various cultures handle pain and illness. um, if the nurse had done her research or been more familiar or more cognizant, she would have realized that the Filipino culture, especially males, they don't express pain. They're very stoic, and if they are going to express pain, it'll probably show on their face a little bit, but they're not going to say anything. The nurse, it's up to the nurse to prompt the patient. It looks to me like you're having a lot of pain. Can I please get you something to release some of that pain? Or can I get you something to make you more comfortable? I can give you this Dilaudid or morphine. And then, you can ask for it every 3 hours. It's just all a matter of being a very good communicator, knowing your culture, who you're dealing with, and using good evidence-based assessment and nursing skills. So that's the end of my presentation. Thank you so much for listening, and here are my references. Thank you so much.